Well, thanks for staying with News at Prime tonight. Since its inaugural meeting in June, a panel of health experts forming the AU Commission on COVID-19 has been working to meet its twofold mandate. Firstly, to identify gaps in the continental response and propose evidence-based interventions in tackling the pandemic. President Cyril Ramaphosa met with members to discuss progress made by this panel. We're joined by the head of secretariat for the AU Commission on COVID-19, Dr. Lwazi Manzi. Dr. Manzi, good evening. Certainly great to catch up with you.
Yes,
we used to see you leading our response, at least the government response to COVID-19, and this time you're over with the AU Commission. You know, one has to look at the kind of plans that the continent had, that the AU had, about how the response, the collective response to COVID-19 could have been versus where we actually are. So initially we heard there was the COVAX plan and how that was going to expedite the distribution of vaccines. That has simply not happened. Is that part of what you and the rest of this panel and commission that has been put together needs to work on now?
Absolutely. You've actually hit it on the nail, because as a commission, we first looked at the president's tenure during 2020. And you will recall that, first of all, he elevated the Africa CDC, to the stature that it is now, an authoritative body. And that was a regional body that was able to make calls on the idiosyncrasies of the regional response. Secondly, he established the African Medicine Supplies Platform. He deployed the African Vaccine Acquisitions Task Team along with the Trust. And he also then established the Joint Continental Strategy. Now, if you look at the strategy overall, you will see that this is a strategy that is underpinned by regionalism, regional response, regional capacity, regional strength. And now let's look at COVAX, as you've correctly pointed out. COVAX was, and still is, a noble attempt at trying to exert some kind of force and pressure in a very, very brutal health products market, to ensure that there was a way of purchasing products, health products, vaccines, therapeutics, etc., and PPEs and all that health products, COVID-19 products and commodities, and being able to then distribute them equitably. But unfortunately, geopolitics, private markets, etc., have unfortunately rendered COVAX unable to actually execute its mandate as they had actually originally envisaged it. And which is why now, as a commission, we've looked at the response that President Ramaphosa actually initiated and have said, you know what, whilst it's really, really important to still put that political will behind multilateral arrangements, it is absolutely critical for us to have a regional response that is so strong that no matter what happens in the multilateral environment, we're actually capacitated to the extent that we can respond effectively to future pandemics as well as the current pandemic.
What would that regional response look like? Because right now we're looking at a continent that by and large has had to import personal protective equipment throughout this pandemic, is not producing its own vaccine and unlikely to be able to do that at least in the next 2 years. And quite frankly, we don't even have the knowledge that we need to be able to produce those vaccines. So what would the regional response that can have a real-time impact on this pandemic, what would that be right now?
Sure. Okay, so let's start with the core response, right? Okay, so first of all, we're wanting to really beef up the surveillance to a point where our surveillance is so strong that we can actually nuance our response and not have this brute force of these hard lockdowns that are really very devastating on a socioeconomic scale. So one of the things that you saw there in that 10-point plan is that we're going to be rolling out 200 million rapid diagnostic tests, right? Now, maybe you can't test everybody, but 200 million is a lot. And if you're able to actually target each regional economic community and you're able to roll out your tests in a manner that gives you that overall bird's eye view of African surveillance, you're then able, and also the strategy is designed that we're going to be rolling them out at a trough phase of the pandemic, which is what we're going through now. So you're going to actually be seeing, we will be announcing the launch of that pretty soon. And the reason why we're trying to do that is so that we can pick up that inflection point very, very early on and ensure that we hone in then on that particular region where we are seeing that inflection point, hone in by targeting vaccination in that region first of all, and then targeting the deployments of therapeutics as well, and then containment measures as well. But as I say, in a nuanced manner, not in a manner that kind of, enforces these harsh containment measures that have a deleterious socioeconomic effect. So the first thing is really to strengthen that surveillance, which has always been a challenge on this continent. We know that many, many countries on this continent don't even have RDTs, and never mind, a testing capacity that really reaches that testing rate that we're wanting to see. So that's the first thing. The second aspect is that, one of the challenges that Africa CDC pointed out, which Africa CDC being the technical secretariat of the AU Commission on COVID-19, they said it was difficult to get information from member states, right, for various reasons. And unfortunately, with the pandemic that moves so swiftly, you actually cannot afford to wait for a long time for information to come through, collate that information, analyze it, model it. You have to do it now, immediately. So then one of the other propositions then to really beef up that surveillance is to then establish a central open source data platform that all member states would be able to, first of all, put the information into, and second of all, look at, so that everybody knows exactly what's happening from a surveillance perspective, and we can all actually have an ability to move swiftly to contain and to treat and to test some more in areas where we are seeing that there's a problem. And of course, there is the absolute critical need to ensure that we are seeing those variants coming through as quickly as possible, because we know that waves are typically driven by new variants.
And all of that will have a significant role to play in terms of activating the responses for the regions.
Absolutely.
It still, however, doesn't deal with the critical issue of how we move from the majority of people on the continent. It's one thing to not be vaccinated because it's your choice, but having the option of those vaccines. And we know that right now, the continent is dominating. So in all of these responses, does it mean that by and large you've maybe given up is not the right word, but you've kind of made peace with the fact that the politics around getting vaccines, at least as much as are needed to the continent, is perhaps a lot bigger than what collectively the AU is able to deliver on right now? And so you're saying, well, what are some of the other things that we can do outside of the vaccine to strengthen our position against this pandemic?
Yes. No, not at all, not at all. So I was coming to a point that you made earlier where you said we may not have the know-how to even manufacture vaccines. And I'm going to say to you that no, that is not true. We do have the know-how of manufacturing vaccines. Now, one of the issues that or rather one of the initiatives that has come out, as you know, is a partnership on African vaccine manufacturing, okay? Now the reason why that partnership came about in the first place was precisely in recognition of all the difficulties that we have had in accessing vaccines, right? We now have about 10 manufacturing hubs across the region, right, which have initially focused on full finish. But let me tell you that there has been a lot of work to work our way backwards all the way to R&D and manufacturing. There's a lot of money that has been pumped in, and there's also a lot of inroads that have been made into tech transfer. For example, that we've got the mRNA tech transfer that's happening here in this country. Now, this agenda, the Commission has decided that it will seriously look into this agenda, and we cannot afford to wait to target 60% of Africa's needs by 2040. We've got to do it right now. Okay, so now how do we actually do this right now? Okay, there's a couple of things that we can do. First of all, the manufacturing agenda does need to be extended beyond vaccines. It can't just be vaccines, it has to be all health products. So that's the first thing. Second thing is we have set up this AMSP, right, and we do have the APCA. So we do have a platform. Somebody actually described the AMSP nicely. It said it's the Amazon of health products, Now, what that does is that it really sort of ignites that manufacturing agenda, because then it says to people, first of all, there's a way that manufacturers can be really visible, and then there's a way that you don't need to go through middlemen, and also you can go straight to the manufacturer and you can purchase. And also, even if you're purchasing small amounts, it's okay, you can actually still purchase to the MSP, because that's one of the big problems with purchasing in the current market environment. If you're trying to purchase small amounts, nobody cares. They just put you in the back of the queue and that's it. So with the PAVM, the Commission is going to support the PAVM to really accelerate this manufacturing agenda and really start to push out product here in the continent for the continent. The AVIT will still focus on trying to get vaccines from outside the continent. In fact, you'll even remember that the AVIT, first of all, recalled doses that were being manufactured here and sent overseas. So they negotiated the recall of that. And with the presidency, they successfully negotiated that no more products that are manufactured on the continent leave the continent. So that's a lot of strides that have been made. And we are going to continue to push for that kind of attitude when it comes to vaccines that are actually produced on the continent, that they get sold in the continent. We're going to mobilize governments to buy products from the continent. And we're going to also, we have been mobilizing quite a bit of capital, particularly private capital, of which we know there's an excess, to really then pump all of that excess capital into product development on the continent so that we're able to really push out products.
Sure, now, but is the continent not still at the mercy of big pharma when it comes to even these different chains of manufacturing? The fact that the reason why the TRIPS waiver is still something that is being fought for is because there are patents that we simply don't have. At least that's my understanding. And that's one of the greatest impediments to our ability to be able to fully manufacture products on the continent. So it's one thing to whether you are, and I'm going to not use the correct phrase here, but whether you're mixing the ingredients or sealing the packages, that has been part of the problem, that yes, we've been involved in those processes, but it still doesn't give us much of a sway when it comes to where exactly this product is going or where it's ending up. And that has been pointed out as one of the key issues for the continent to say, but where do we stop with that reliance? So how long are we going to need to be reliant on these big pharmaceuticals before we're able to produce our own product?
Yes. No, you're absolutely right. We can't actually get away from that truth, you know, that the vaccine market, look, the situation with the vaccine market is this. The manufacturers are businesses, right? They will first sell their product to the people who funded the R&D of their product. Then they're going to sell the product to the biggest bidder, all right? Now, apart from us really pushing the manufacturing agenda here on the continent, pushing a continental sort of independency, we still will need to negotiate at that multilateral level. And we have been negotiating very, very hard. As you know, South Africa is one of the co-chairs of the ACT Accelerator. And on that platform, we push very, very hard for swapping of delivery schedules, right? We're pushing very hard for Big Pharma to pay attention to the fact that we do actually need to distribute equitably. We're paying attention to the ability of COVAX to do the work that it needs to do. And you know, the COVAX has just come under review. And one of the issues that came to the fore was the issue of inclusivity. And the issue of inclusivity is absolutely critical because unless you have the right voices there expressing exactly what you're expressing, then nobody's going to actually pay attention. So that issue has been pushed to the fore. We have been negotiating with the high-income nations to share and not share them in the last minute when things are about to expire and now we have to scramble on all of them, but to actually, if they have an excess, to share. And of course, we, you know, as with the WHO, we have been pushing that before you pursue your booster programs, you know, you really need to actually be redistributing those extra doses that you have, and then only afterwards actually pursue then a booster program.
Sure.
So we are pushing an aggressive manufacturing agenda, but at the same time, we are really negotiating hard, and we're putting forward business cases. So it's not a humanitarian argument that we put forward. We put forward numbers and a business case for the equitable distribution of all products, not just vaccines, of course, which are very important, but all products for COVID-19.
Dr. Lwazi Manzi, we're going to have to leave it there for this evening. Certainly the latest when it comes to the work that is being done by the AU Commission on COVID-19.